Good day, sir. I am Chris Madaltayopon, your nursing aide for today, and today I will going to demonstrate administering a tube feeding. The purposes of this procedure is to maintain or restore nutritional status and to administer medications. Equipment materials needed are correct type and amount of feeding solutions, 60 ml catheter or tip syringe, emesis basins, clean gloves, pH test strip or meter, measuring container from which to pour the feeding, purified water 60 ml, then feeding pump as required. Then next, for assessment, we need to assess for the following: clinical sign of malnutrition or dehydration, allergies to any food feeding. If the client is lactose intolerant, we need to check the tube feeding formula. Then notify to the primary healthcare provider if any incompatibilities exist. Then check the presence of bowel sounds, problem that suggests lack of intolerance of previous feedings, such as delay gastric emptying, abdominal distension, diarrhea, and cramping or constipation. Then for planning, determine the type, amount, and the frequency of feedings and tolerance of previous feedings. Then identify all materials needed, place or bring to the bedside to save time and effort. And afterwards, for implementation, introduce self, verify client's identity, and using agency protocol, then explain to the client what we are going to do, why it is necessary, and how the client can cooperate. Then inform the client that the feeding should not cause any discomfort or harm to him, but he may feel a fullness. Then assist client in Fowler's position, at least 30 degrees elevation, in bed or sitting position in the chair. If the sitting position contraindicated, we can use right side lying position. It's acceptable because this position enhance gravitational flow of the solution, and it prevents the aspiration of fluid to the lungs. Next, perform hand hygiene and observe any infection control procedures, and provide privacy by closing the curtain around the bed and close the door if applicable. Then next, assess the tube placement. Afterwards, we're going to inject the syringe. I attach the syringe to the open end of the tube and aspirate. So after aspirating, we are going to test it, but before that, we allow 1 hour uh, to test the pH if the client received medications. But if not, we just direct. Then next, we are going to place a stethoscope over the client's bigastrium and inject 10 to 30 ml of air while listening to the whooshing sound. Next, assess residual feeding contents. So we are going to aspirate all contents and measure the amount before administering the feeding, because we need to evaluate first the absorption of the last feeding, whether it undigested from previous it was remain. Then if the tube is in the small intestine, residual content cannot be aspirated. Then we are going to aspirate and if we aspirate 100 ml or more than to the previous feeding, so we need to rely to the nurse in charge, or we are going to refer to the agency before proceeding the procedure. And next, we reinstill the gastric contents into the stomach if this is the agency's policy or from primary care provider's order. Because removal of the content could be disturb the client's electrolyte imbalance. Then, if the client is on continuous feeding, we need to check the gastric residual every 4 to 6 hours, or according to agency or institutional policy, then administer the feeding. Before administering the feeding, we're going to check the expiration date of the feeding that the physician order us to administer. And we are going to warm it in room temperature, because excessive cold feeding may cause abdominal cramps of the client. Then, when an open system is used, clean the top of the feeding container with alcohol before opening it. To minimize contamination entering the feeding syringe or feeding bag. Next, for syringe open system, we need to remove plunger first, then connect. After connecting, we need to clamp it, so that if we are going to place the feeding, it will not go directly, because quickly administered feeding can cause flatus, cramps, and or vomiting to the client. So the measurement of feeding is measured, then we're going to place it there. Afterwards, we're going to permit flow. The flow rate should be according to physician's order. Then adjust it, put it what we call this one, raise the or lower the syringe to adjust the flow as the order. Then next, for feeding bag, we need to hang the level bag infusion in the pole, which is 30 cm or 12 inches above the tube's point of insertion into the client. Then we need to clamp it to run the formula through the tubing and reclamp the tube, because the formula will displace the air in the tubing, thus preventing the insulation of excess air into the client's stomach or intestine. Then attach the bag to feeding tube and regulate the drip by adjusting the clamp into the drop factor on the bag. according to physician's order. Then pre-filled bottle with drip closed system. So first we're going to remove the lump, the screw cap of from the container. So this one we need to remove. Then attach the administration set with the drip chamber of the tubing. So after removing, close into the drip. Afterwards, close the clamp and tubing, and we're going to hang 30 centimeter above or 12 inches. Because this height, the formula should run at the safe rate into the stomach or intestine. Then we're going to squeeze the drip to refill 1/3 of 1/2 of its capacity. Then open the clamp, run the formula through the tubing and reclamp the tube. Because the formula displaces the air into the tubing, thus preventing the installation of excess air. Then we're going to attach the feeding set to the tube, then regulate to deliver the feeding over this desired length of the time, or attach the feeding pump to follow the procedure. Then we're going to flush we need to flush the feeding tube before all of the formulas run through the tubing, because flushing will flush the feeding or the medication if it was the previous one on it. So we need to install 50 to 100 ml of water through the feeding tube medication port. Because installing or water flushes the lumen of the tube, preventing future blockage of the sticky formula. Then we need to ensure that to add the water before the feeding solution has drained from the neck of the syringe or from the tubing of an administration set. Because adding the water before the syringe or tubing is empty prevents the insulation of air into the stomach or intestine, and thus prevents unnecessary distension. Then next, clamp the feeding tube before all of the water is instilled. Then we are going to ensure the safety of the client, or if he is safe. So we need to clamp the tubing to the client's gown, so that even if the client moves or accidentally move, the the tubing will not move or remove. This minimizes pulling of the tube and prevent to discomfort and dislodgement. Then we're going next, ask the client to remain in his position, elevated right lateral position, for at least 30 minutes, because this position facilitates digestion and movement of the tubing from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. Then check the agency institution's policy on the frequency of changing the nasogastric tube and the user of smaller lumens tube if a large bore tube is in place, because these measures or prevent irritations and erosion of the pharyngeal and esophageal mucous membranes. Afterwards, dispose all materials, equipments in appropriate place. And if the equipment is not if the client is to be reused or reusable, clean it, wash it through soap and water so that it will ready to use again. If we need to use it, then change the equipment every 24 hours according to the hospital's policy, and wash hands. After wash hands, for evaluation, perform a follow-up examination of the following: tolerance of feeding, vowel sounds. For tolerance of feeding, the clients feel like nausea or cramping. Well, then for the vowel sounds, for now, sounds good. Then regurgitation and feeling of fullness after feeding. So if the client feel it, then weight gain or loss, fecal elimination pattern such as diarrhea, flatulence, constipation, then skin turgor, then urine output and specific gravity, which we have via test, then laboratory test, then glucose and acetone in urine, then relate all findings to previous assessment data if available, and report significant deviation from normal to the primary healthcare provider. Then afterwards, for documentation, document the feeding, including amount and kind solution taken, the duration of feeding and assessment of the client. Then record the volume of the feeding and water administered on the client's intake and output record. That's all. Thank you.